Dave Weigel, a question from Mr. Foster. In the beginning, you mentioned the effect of the Affordable Care Act's reforms, and I wonder if you could speak to, I guess, one, whether as the math looks, you can use those savings to fund the system and to fill the fund. Two, how the picture changes if there is no Affordable Care Act, because that's up in the air. Does that do anything? Does that extend the viability of the system? Does it not change it at all?
I don't know why I like this question so much, but maybe it's the troublemaker in me. But you're really asking the double counting question. Is it legitimate or fair to is it legitimate or fair to count the Affordable Care Act Medicare savings as both being used to help pay for the coverage expansions elsewhere in the Affordable Care Act, as well as extending the life of the Hospital Insurance Trust Fund? It is legitimate, but let me tell you how it works, then you can decide for yourself whether it's double counted or not. So to use a simplified example, let's say you as an individual have to pay an extra $100 in hospital insurance payroll taxes because of the change in the Affordable Care Act. So an extra $100 in actual cash comes from you to the Treasury, and it's credited to the Hospital Insurance Trust Fund. We get a bond of $100 for it. The cash itself is still sitting there, and it will be spent like that. Money does not sit around long in the Treasury. It may well be spent to help pay for other Affordable Care Act provisions or anything else that needs to be spent on. So your $100 is spent, but I have a promise for the Hospital Insurance Trust Fund that anytime I need that money back, I can get it. So let's say it was spent for other coverage expansions, and now 3 years later I need it back to help pay for hospital insurance costs. So I let Treasury know. They come up with $100 in cash plus the $5 in interest they owe or whatever it might be, and they give me that cash and I spend it. So far we've had need for $200, $100 over here for the coverage expansion and $100 for HI. And we spent $200 and I got my money back, but you only paid $100. When I got my money back, Treasury had to raise that money some other way. They'd already spent your $100. And they had to raise it by further borrowing or not spending some other $100 or raising a new tax for $100. So on the one hand, all this is nothing new. This is traditional trust fund accounting. That's just the way it works through the lending and redeeming operation. On the other hand, if you're going to spend $200, you need $200.
There is an issue here on the budget because your own actuary has said you can't double count. You can't count 500. They're attacking Medicare on the CR when their bill, your law, cut $500 billion in Medicare. Then you're also using the same $500 billion to what? Say you're funding health care. Your own actuary says you can't do both. So my simple question, I have 26 seconds left. What's the $500 billion cuts for? Preserving Medicare or funding health care law? Which is it?
Sir, the Affordable Care Act is 12 years to the Medicare Trust Fund, according to every actuary, and the $500 billion represents a slowdown in the growth rate of Medicare over 10 years from what was projected at 8% to a growth
so
rate
is it
of
Medicare? Is it using it to save Medicare, or are you using it to fund health care reform? Which one?
both.
The gentleman's
So you're double counting. I yield back my time.
gentleman's time's expired.